Understanding and affording your diabetes prescriptions can be difficult. Developed by a doctor who knew there had to be a better way to overcome obstacles to glycemic control, IntellaRx began as a tool to help its own patients, but realized almost 30 million others struggled with the same problem. His goal is for patients to develop a thorough understanding of their medications and to simplify the process of affordability. A healthy lifestyle should always be a patient's first step. However, diabetes is a journey that may require a diabetes prescription. Let IntellaRx help your patients start their journey, save on their prescriptions, and stay on track. The resources available to help a diabetic patient address their condition and understand their medications are numerous, but scattered. We organize free resources and provide direct access to prescription savings programs, education, and personalized support. A provider must first convince a patient of their next best course of action. In the current healthcare environment, healthcare providers have a limited face-to-face encounter, which does not provide adequate time for thorough medication education. This often leads a patient to self-educate and search the internet. Unfortunately, a patient is more likely to land on an opinion-based blog sites, lawyers, solicitations, or unofficial YouTube videos. The confusion that follows leads to a sense of mistrust towards providers, pharmaceutical companies, and the healthcare community as a whole. Patients need a trusted support system to ensure long-term medication adherence. Pharmaceutical companies have developed evidence-based, FDA-approved resources to help patients with education and personalized support, entirely free. Patient engagement platforms continue to lack awareness within the healthcare community. IntellaRx is a patient-centric platform beyond the prescription. IntellaRx is a digital distribution channel to easily extend the provider and patient dialogue before and after the prescription is written. Getting started is simple. First, a user signs up for a free account, enrolling either as a patient or healthcare provider. We want a user to understand the various treatment options and to create drug class awareness. Therefore, a user can search by a specific drug name or an entire drug class. To understand the differences between drug classes, they are color-coded to easily see similar alternatives in the same class. Fixed-dose combinations show the combined colors of the represented classes. A personalized digital, interactive medication list is created. A provider then initiates the education process at the point of care by reviewing the appropriate drug info, such as how the drug works, side effects, and the most frequently asked questions. For injectable drugs, how-to videos are shown at the point of care. The provider clicks on the appropriate resource to have an educator reach out to the patient. The Savings Card button shows the patient how to access the digital manufacturer's savings card or free trial offer. To redeem, the patient can either print their unique card numbers or simply show the pharmacist the card as it appears on their phone. Within minutes, the patient has been thoroughly educated with FDA-approved material, provided up-to-date savings programs, and has been connected to a support system to help hold their hand outside of the office. But diabetes is a chronic condition that requires continued engagement from both the provider side and the patient side. IntellaRx is a HIPAA-secure diabetes management platform, and glucose tracking represents the platform's core interaction and call for action. As information regarding blood sugars is exchanged, IntellaRx uses FDA-approved pharma content to keep healthcare providers and patients engaged. To help study population health outcomes, IntellaRx uses powerful analytics software to analyze users' behavior and generate data from both patients and providers, leading to real-world clinical research and market research opportunities. So, whether it's at point of care, a hospital prior to discharge, or a patient at home, think of IntellaRx as the digital diabetes prescription platform aimed to increase medication adherence and decrease self-discontinuation. Every aspect of IntellaRx offers an opportunity to expose patients and providers to new products, campaigns, and updates. Whether using the personalized digital med list, our proprietary algorithm, our version of the ominous octet, glucose tracking, or communication. Brand exposure and drug class awareness are continuously promoted. Join us in changing the typical recommendation of diet, exercise, and medication into diet, exercise, medication, and IntellaRx, a digital diabetes engagement and medication adherence platform.